Assalamu alaikum. My name is Dr. Hiba Salim. I am a graduate of Janassan Medical University, batch 2022, and I completed my internship from the AKUH University Hospital in 2023. Overall, my experience as an intern at AKUH was amazing. I learned a lot over there. I enjoyed my time working there, and it certainly was a good start to my medical career. I basically applied to Khan because it was so well known for having great medical practice, and then it was also well known for having a better work environment than most of the other institutions. So, as expected, when I started, the work environment that was over there was excellent. The wards were really clean. The entire hospital was very clean. And then the call rooms that we had, those were all very, very tidy, very neat. And apart from that, the people that you worked with, from the administrative staff, the nursing staff, the residents, fellow interns, consultants, everyone is really nice. So when you have a good work environment, naturally you enjoy working. And yeah, so that's something that was there. Secondly, there is this misconception about when you do your internship at Aachen, you do not get enough hands-on experience. So this is completely wrong because when you are working there, like for me, as an intern, I was allowed to do everything that was safe for me to do, ensuring that patient care, patient safety was not compromised. So when the patient gets admitted, elective or non-elective emergency patients, all of them, you are at the forefront as an intern. So you have to take the history. You are clerking the patient. You do the initial physical examinations, and then you are also responsible for doing the basic clinical skills like for example, taking blood samples, doing ABGs, things like that. Apart from that, you are not required to monitor vitals and do constant um, monitoring of vitals throughout the day. That is something that the staff does. So, but it's all documented in files. So you are supposed to go and keep looking at the vitals, making sure that the patients are doing fine. And as an intern, you are always in the ward, so naturally, you have to face everything that's happening over there. The residents do keep coming, and they are also there in medicine. In medicine, the residents are present all the time. In surgery, sometimes the residents aren't available because they are in the theaters, but you are in the ward, so everything is up to you. And but they are always available to communicate with on phone. So it's really nice and it's very easy. You have pagers, so anything happens, you get paged for it. You can page your resident to get into contact with them. So it's very convenient working there in this sense. And more importantly, as I mentioned, that you're always in the ward, so you have to talk to attendants, talk to patients, so that also improves your communication skills a lot. And it's not just the part where you keep working, there's also the whole part of learning, because when you have rounds, you have morning rounds, then you have exit rounds, and during the rounds you're also taught by residents. There is bedside teaching as well, so you do gain knowledge. And you, in surgery, you are allowed to attend ORs, you are allowed to scrub in, and you are allowed to assist in surgery, um, to an extent where, again, patient safety isn't compromised. You attend clinics, and it was a really good experience. I learned a lot, especially in clinics. You do get to learn. So in wards like urology and cardiothoracic surgery, then even in general surgery, internal medicine, in pulmonology, like I can only talk about the rotations that I was in. So you get to go to clinics, attend OPDs, and that was a good part where I learned a lot. Coming to talk about the working hours, so they basically varied depending on ward to ward, but at an average, the daily normal working hours were 10 hours, and then apart from that, your calls are can vary from 25, 26 hours to 30 hours. and it basically depends on how um, busy the ward is, how much patient load you have. So it basically depends on that. Then for emergency department, you have 12-hour shifts. So you have 12-hour daytime shifts, then you have 12-hour nighttime shifts. Again, they like depend on your rota. Uh, like when you're gonna have your day shift, when you're gonna have your night shift, all of that depends on your rota. So when I was doing my internship in surgery, most of the departments, your call was on every fourth day. So every fourth day you'd have a call. And in medicine, it was very much dependent on how the chief resident makes the rota. So you have around 4 to 5 calls in a month in medicine as well. And apart from that, the workload I would say is quite hectic because you have a lot of patients, and especially when you're on call. During the day, it's fine because the entire team is available, so the workload is divided. But then when you're on call, so for example, in surgery departments, they're mostly all single intern calls. So you do get bombarded with a lot of work that needs to be completed because obviously the patients are waiting for surgery. In medicine, you are on call with your team, but still, as an intern, you have a lot of things to do that are piled up. So, yeah, that's there. And then again, as I said, that there's a lot of documenting. So that also is very time consuming. So you have to do all of the work. You have to look after the patients, and you have to make sure that their labs are coming in and the labs are being sent. You're chasing labs, you're chasing radiology, you're doing everything on call. So it can get very hectic, specifically on calls. In emergency departments, it is very hectic, obviously, because it's emergency. It's very fast paced, but but I would say that it's very enjoyable because personally, I felt like I learned the most over that. Another good experience that I had there was that the system that we have for storing patient data and accessing patient data over there was computerized. So you get a good hang of how to access patient data on a computer system, and then you have to like making discharge summaries, prescribing medications, viewing radiology, doing other tasks like ordering blood from the blood bank. All of that was computerized. So you get to learn the system as well. So that's really good, specifically if you are planning on doing your residency or progressing further abroad. So the systems over there in the US, the UK, they're mostly computerized. So you gain experience in that area as well. So, talking a bit about the wards that are there to work in, um, um, all of the wards are equally good to work in, but obviously some are more hectic than the others because patient load in certain wards is higher than the others. So, wards like psychiatry, family medicine, pulmonology, urology, uh, these are all departments where the patient load is comparatively lower. So, it's more preferred by interns to choose these. But then again, I would say that whatever specialty you're interested in, uh, do choose that ward as well if you are planning to work here, because you will get to learn a lot and it will be really beneficial. And finally, for people who are planning to do their residency in the future at AKUH, I would say that doing an internship here would definitely be helpful because you would already be well aware of the system. You will have a good familiarity with everyone that's at the hospital, a good familiarity with the system and with the protocols that are followed there. So that really helps you a lot. And more importantly, from what I from now this rule, I'm not sure if it has changed, but back when I was working, the rule was that if you complete your internship from AKUH, then you are exempted from the residency entrance exam for AKUH. But you do have to sit the interviews, but you would be exempted from the exam. But you would be exempted from the exam. But this exemption would only be for 2 years from the time you have completed your internship. But again, I'm not sure if this rule still is there, but this is what the rule was back then. So that was also really helpful because a lot of people appear in the entrance exam and it is quite competitive. So you do get kind of like a like an advantage in the sense that you get to skip the first step. So that's also something that's really good. So, all in all, I would say that I had a very good experience working there. It was very enjoyable, and I would definitely recommend you to do your internship from Khan. And good luck to all of you who are applying for the program.